never came. I was naked, hungry, and so cold. I was frightened, I was suffering, but the torment was I suffered all alone. Remember then the brothers who are suffering. Remember that your sisters are in pain. For some of them the sun of hope is setting. For others it will never rise again. The chains can't bind the hopefulness, and the bars can't block the means of grace. And the distance that might separate cannot defeat the prayers that we might suffer in their place. After all, these could be your own children dying. Your wives, your mothers, your husbands, and your sons. Weep the tears that they are crying. In prayer we take our stand beside them, so they won't be alone. So fellow prisoners, remember that we may know captivity. There's a purpose in the calling, for it is the Lord who sets the prisoner free. After all, these are your children dying. They're your wives, your mothers, your husbands, and your sons. Tears that they are crying. In prayer we take our stand beside them, so they won't be alone. So they won't be alone.
So they won't be alone. This is the heart of why Mercy Ships exists, to bring hope and healing to the world's most needy people. Hope, so they won't be spiritually alone. Healing, so they won't be outcasts due to their sicknesses, diseases, or deformities. Mercy Ships' growing fleet, the Anastasis, the Caribbean Mercy, the Africa Mercy, and the ships to come, reach out into the poorest and neediest areas of the world. Those areas that have yet to hear, feel, and see the love of God.
I'm on location in West Africa. In this part of the world, we see 82% of the poorest of the poor. Well, how poor is poor? In the United States, Canada, North America, Western Europe, our per capita income is about $18,500 per person. Here, in the needy parts of the world, it's $200, $300, depending on the nation. We have one doctor per 418 people in Germany or North America, but here it's about one per 15,000. Dentist is perhaps an even greater indication. We have one dentist for every 1,500 people in the Western world or the English-speaking world, but here in the needy areas of the world, it's one dentist for 100,000 to 150,000. And because I'm convinced that the spiritual reality of life is often the deepest cause for the physical suffering of life, we should look at the spiritual need. This is the part of the world that has the least exposure to the love of God. And our ships are making a difference. Some of the stories, some of the lives that have been changed forever and for eternity will bring joy to your heart.
The tumour in Patrick's face began as a tiny spot close to his teeth. For 18 years he'd endured the rituals of native medicine men and disappointments from different doctors. He received news about a giant floating hospital, a mercy ship that was in his city, and he attended the medical screening. He was accepted for surgery, and Mercy Ship surgeon Dr. Gary Parker performed 2 operations to remove a 3.5-pound tumour. The change was remarkable. These surgeries freed Patrick from his prison of hopelessness and gave him joy. Deep in the heart of El Salvador, sisters Isabel and Elsa were both born with club feet. The younger sister Elsa was just learning how to walk on her disfigured feet when Dr. Tim Brown from Mercy Ships first met her. Isabel's feet had grown completely backward because she did not have access to medical care for 11 years. Following Dr. Tim's successful operation, a beaming Isabel could now do the things other girls her age could do. Chores around the house, going to school and playing, all with shoes on her feet. Isabel's chain that kept her from walking properly was loosed because Mercy Ships reached out and made a difference in her life. Malachi lived with his parents and several siblings in one rented room. The highlight of his day had been being pushed and pulled through the dusty streets while sitting in a cardboard box. Malachi, like his mother and 2 of his brothers and sisters, was virtually blind. A Mercy Ship surgeon operated on Malachi and restored his sight. When Malachi looked into the mirror for the first time, he said, "I'm a black, handsome boy." Malachi's chain of blindness had been broken by a skilled Mercy Ship surgeon. When Usman first arrived on board a Mercy Ship with his mother, he was severely malnourished. He could not drink because of a cleft lip and palate. At about 6 months of age, tiny Usman weighed less than 3 pounds. Mercy Ship staff immediately placed him in a feeding program to gain weight in preparation for his life-saving operation. A few days after Dr. Gary operated, Usman and his mother returned home amid great rejoicing. Usman was wonderfully released from his prison of an imminent death by Mercy Ships.
After all, these could be your own children dying.
Patrick, Isabel, Malachi, and Usman were all prisoners of hopelessness until they came to a Mercy Ship. On board, they didn't suffer alone as they were cared for by loving and professional staff members. You see, on board a Mercy Ship, these fellow prisoners received back their hope and they were given a new life. Mercy Ships brings hope and healing to hundreds of thousands of people each year, but we can't do it alone. By partnering with Mercy Ships, individuals, companies, and groups extend their own hands to the prisoners of hopelessness. I personally invite you, become a partner with the poorest of the poor. Partner with Mercy Ships. Become an advocate for the poorest of the world's poor. Thank you for helping Mercy Ships bring hope and healing.
These are your children dying. They're your wives, your mothers, your husbands, and your sons. So we must weep the tears that they are crying. In prayer we take our stand silent, so they won't be alone. So they won't be alone.
For 25 years, Mercy Ships has brought hope and healing to many, providing healthcare, education and development assistance in many developing countries. In the places where Mercy Ships has worked, the lack of health education, medical provision and clean water means that preventable diseases and treatable medical conditions are rife. War, inadequate infrastructure and many other factors further restrict development. Statistics from the UN Human Development Report illustrate the scale of the need. In Sierra Leone, over 30% of children die before they reach the age of 5. Most people have no access to safe, clean drinking water, and access to medical services is extremely limited. Statistics like these are common in many African countries. In response to such need, Mercy Ships operates a fleet of ships staffed by volunteers. This allows on-board surgery and development projects to take place free of charge. The lives of many individuals and communities are changed. When a Mercy ship arrives in a port, thousands attend screening sessions, hoping for a chance of life-changing surgery. Many are accepted to have cleft palates, crossed eyes, clubbed feet, tumours or cataracts corrected. These procedures are relatively simple, but they have a dramatic impact on the lives of those who have suffered. As well as their physical healing, patients often find acceptance in their communities for the very first time, where they have previously suffered ridicule and rejection. Off the ship, medical and dental teams set up clinics in outlying villages. Working alongside local people, they provide dental treatments, vaccinations and basic medical care to those who would otherwise have no access to these facilities. A major underlying cause of poor health is lack of education. Mercy Ships teams provide community health education to village health workers who then go on to teach others. Topics covered include prevention of malaria and HIV/AIDS. Mercy Ships also teaches on the need for clean water and adequate sanitation to reduce the spread of waterborne and waste-related diseases. Alongside this teaching, students learn to repair wells and build latrines. The ships provide a cost-effective means of transporting construction supplies, which are used to build houses, health clinics and other facilities. In an ongoing project in Sierra Leone, village representatives are receiving vocational training whilst rebuilding houses destroyed in the war. Mercy Ships also supported a recent local initiative to build a health clinic to provide much-needed maternity care, vaccination programs and a dispensary. In many parts of Africa, low agricultural production leads to poverty and malnutrition. Mercy Ships helps to stimulate local economies and food production through agricultural training and initiatives. In an ongoing program, Mercy Ships imported sheep and goats and provided them to families whose livestock was destroyed in the Civil War. Others are receiving agricultural training using simple methods such as drip irrigation. At the heart of Mercy Ships is the Christian message and its call to action. Mercy Ships seeks to demonstrate the love of God by giving physical and practical assistance wherever possible, as well as addressing psychological, emotional and spiritual needs. This pattern of Mercy Ships work has been developed and refined over 25 years, and many thousands of people have been helped. There are currently 2 ships in operation, the 12,000-ton Anastasis and the 2,000-ton Caribbean Mercy. In the mid-1990s, Mercy Ships leaders began to look for a new ship to increase the number of people that could be helped. In 1999, they were given a generous donation to purchase the 16,000-ton Dronning Ingrid, a rail ferry built in 1980 by the Danish government. The ship was renamed Africa Mercy by Dame Norma Major, a Mercy Ships patron.
Today marks the start of a new life for this amazing ship. A lifetime in which she will bring untold relief and salvation to hundreds of thousands of Africa's most poor and neediest people.
The Africa Mercy is currently being converted into a state-of-the-art hospital ship in a shipyard near Newcastle upon Tyne. When completed, she will contain 6 operating theatres and 78 hospital beds. Areas of the ship are also being converted into cargo space and staff cabins for over 400 crew. It is hoped that the new ship will be ready to enter service during 2004.
Well, welcome aboard the Africa Mercy. We're walking into the reception area now. When this was a ferry, over 2,800 people would come through these doors every sailing. When we have it, there'll be a reception area here, where all this mess is here. As we carry around, there'll be several offices over this area here. The CEO will have his office there. There'll be some storage area underneath the stairwells, and along here there'll be several walls that need to be erected for fire regulation. We're walking into the town square. This was used as a cafeteria when the ship was a ferry, but behind me we'll be using this as a bookstall and some offices over there. We'll be keeping the cafeteria here, and then as we come over here we have an area of seating which can be used for people who are taking tours to come and have a cup of coffee, and also for the crew in the evening to come and relax. From here we're going to go up to one of the family cabins. This is a 4-berth family cabin. Over this area here we have the sleeping area for the parents. As we move over through the cabin, we have a small kitchenette over here for cooking purposes, and a small dining room here. Through here we have the small bathroom with a shower, toilet and a sink. Then through here we have 2 berths for the children. When the ship was a ferry, this deck did not exist. We've added this deck and it will house 196 single crew. Each of them in the cabins here will have their own single ensuite, and below us is the hospital.
My name is Alphonse Abraham, and I'm the chief engineer here on the Africa Mercy. Presently I'm standing in main engine room number 1. Altogether we have 6 main engines, 3 on each side, connected to 2 gear systems. The forward 2 main engines have recently been coupled to 2 new alternators generating 2.6 megawatts each. This increases our generating capacity to just under 10 megawatts on this vessel.
What excited us about buying Africa Mercy was it provided us the opportunity to purpose-build facilities on board, almost combining 2 worlds of having a basically new vessel but not having to incur the costs of a brand new ship. In it we would insert 6 operating theaters and a 78-bed ward. It would also present us plenty of room to design the support facilities and the crew amenities to run the hospital and our various relief and development operations. Never before have we had this kind of opportunity with a blank sheet of paper, as it were, to optimize our operations.
Hello, I'm Roger Nowicki. I'm the project manager for the conversion of the Africa Mercy. And I'd like to just show you the cargo area. You can look aft here. This is where the old door used to open up that the trains used to roll in and out of. We've converted this into a large cargo area where we'll drop in 20-foot containers. And this will facilitate us to very easily move the containers on and off the ship for outreach. We can put them on the dock, open them up. We can take the materials out and distribute them wherever they have to be. We've just left the cargo area. We've now entered the lower part of what was the old rail deck. It's now going to be converted into the hospital ward. This will house about 78 patients when it's complete. And if you can imagine this vast open cavity here that we have, that we can make this into just about anything we want. This side will be the ward. The other side, which is identical to this, is going to be the operating rooms, and those will be all custom built. This gives us these wide open spaces to do with it whatever we want.
I think it's going to be
As you can see, we've just come from deck 3, hospital deck. It's quite noisy down there, but let me take you up to deck with a view. Welcome to deck number 8, the deck with a view. This is where we'll be storing all of our vehicles. About 23 Land Rovers, well drilling rigs. We look forward to seeing a bunch of vehicles on board to provide care for people.
All of what you've seen today, the plans, the ship, the people, all translates down to the reason why we do what we do. Thank you for dreaming a bit with us, looking at the plans, and hopefully catching a bit of vision. We look forward to partnering with you.